Hey guys, if you can hold on. I've got a live mic for just 1 second. Brian, I'm doing a sound check. Can you hear me? Excellent, thank you. Okay, am I muted, Sam?
Hey Deb, this is Lynn. My team and I are here.
Ready, Sam? Okay, we're ready. Okay. Welcome, everybody, to the Nominating Committee of the Cook County Health and Hospital System Board of Directors meeting today. Glad those of you who are here in person could join us. I'm Margie Schaps. I'm the chair of this nominating committee. I'd like to first invite a roll call, and as you mention your name, introduce yourself. We have a new, introduce where you're, what organization you're with, and I know we have a new member today, so welcome, Joe, and we'll hear from you in a moment. So let's have a roll call.
Okay, I'm going to do the roll call and call out the name of the organization, and if the person representing that organization can state their name and then whatever other introduction. First is Association of Community Safety Net Hospitals. And she is not present. She was planning on being remote, but I do not see her connected. The next is Chicago Department of Public Health.
Good afternoon, everyone. It's Jen Bynum. I'm here on behalf of the city.
Thank you. Next is Chicago Federation of Labor.
Hello, Andrea Kluger with the CFO.
Thank you. Next is Chicago Medical Society. And I do not believe Dr. Orris is connected. Next, Chicago Urban League.
Good afternoon, everyone. This is Karen Freeman Wilson on behalf of the Chicago Urban League.
Thank you. Next is Civic Committee of the Commercial Club of Chicago.
Good afternoon, everyone. This is Lam on behalf of Civic.
Next is Civic Federation of Chicago.
Joe Ferguson on behalf of the Civic Federation.
Welcome, Joe.
Thank you.
And Cook County Physicians Association.
Audrey Tangsley, President.
And Health and Medicine Policy Research Group.
Margie Schaps, President.
Healthcare Financial Management Association.
Good afternoon, everyone. Fred Lebed, representing HFMA.
Illinois Public Health Association.
Sue Avila for the Illinois Public Health.
And Illinois Health and Hospital Association. And that would be Jennifer Kohler, and I do not see her connected remotely. You do not have a quorum.
Okay, given that we do not have a quorum today, I will make a suggestion so that we can follow up. We do have a meeting scheduled for March 29th at 9 a.m. in this room. Hopefully we will have a quorum at that meeting. Given that this group has a lot of history of filling vacancies and making recommendations to the president for vacancies, my recommendation to the group today is that every organization submit a maximum of one nominee to the board. To submit that name to Deb on the nominating form that we've used in the past, and Deb has sent us via email recently and with the packet, that those be sent to Deb no later than 3 p.m. on the 25th of March, so that she can then, by 5 o'clock that day, send out the full matrix of recommendations to all of us. That would give each of us 4 days to review those recommendations, ask questions, do our own research if we wanted to, and then come together on March 29th to actually vote. So I would ask, so I'm making that proposal to everybody because we can't have an official meeting today since we don't have a quorum. If you have a problem with that, please reach out to Deb after this meeting. I think we can't really talk about that right now. So yeah, if that presents a problem for anybody, that timeline that I just presented, and I can go over it again if you want. If you have a problem with that, reach out to Deb. She will have to then, if there are problems presented, we will have to reschedule that meeting on the 29th and look for another date for all of us to come together.
Do you mean reschedule the planning meeting?
I think
and,
so.
and then keep the 29th
Yep.
date? Because we can't go any further than
Yes.
29th. Okay, I just wanted to double
Thank you.
check. Okay.
Yes. Any questions? Can I take questions or not? No, no questions.
I think, I'm understanding the principle here is that the action meeting is actually the 29th. And so this is merely a setup, so we don't actually need to go through the full formality of a quorum and decision-making. We're just setting up the next meeting. Is there any way, and obviously I'm new to all of this, the quorum requirement in terms of physical presence relative to digital presence, is that something that was derived for COVID? Is there any thought of asking for revisitation of that in light of the world as it has evolved, so that we're not in this situation in the future? Because it looks like from the materials that you've provided, there are a number of other vacancies probably looming near term, so we're going to have to figure out how to make this happen with greater expedition.
I can provide, this is Deb Santana. I'm secretary of the board. I'm not the attorney.
Right.
I could just provide maybe some insight on how we operate at the Cook County Health Board. During the period of COVID, we had the ability to meet remotely, and it was very structured on what kind of things that parameters. Now that we are outside of that, the Open Meetings Act basically goes back to the original Open Meetings Act, which did allow for remote participation. It just required that you have a quorum of members physically present at the meeting location. So it's kind of we have the flexibility to have remote participation, but we still have to have that physical quorum of members.
Could I ask that, because this happens frequent, I mean, it happened in the last time when we met, is there a way that we could, how many people do we need?
7.
Extra. How many? 7. So is there a way, even before we meet, that we could remind people and ask them to please confirm if they're going to be in person, that because we need 7 people sitting here?
I have their responses from the poll on whether they said they could attend. I'm happy to send out a quick,
I mean, you do so much, Debbie. I don't want to make your life
I do it
worse.
with my current board. So if it means that it's just a reminder, like, hey, you committed that you were going to come, let us know for sure. I don't mind doing that. I don't mind.
I mean, I think some people don't realize there's got to be 7 people here. I mean, they forget.
Yeah, I don't mind doing that. I'm happy to do it.
Yeah, and to sort of put a lawyerly overhang to it, it's a communication expressly stating what the requirement is, and that that we need their confirmation of physical presence for the record. So there's a matter of record of who's coming and who's not coming, who's showing up and not being able to actually do what they came to do.
I just want to weigh in on this. I think we should do that. I just want to say that we did have 8 people who committed to coming today.
Yeah.
So 2 people and
Something happened.
it's okay.
But maybe
I don't do it.
If it saves us some time to travel, and
Yeah,
it's okay. I don't mind.
Yep, thank you.
yeah. And
Can I just
to your
ask-
earlier point, Joe, we will have 3 more vacancies come this summer.
Yep.
So there's going to be a really heavy burden on this group over the next 4 months to identify a lot of people. So I think if it's okay to include this in my recommendation, for all of us to start thinking about additional names, because that's going to happen, that will arise very, very, very soon.
One thing, and I don't know if I can say this at the meeting, but with Otis Story no longer on the board, and that's a direct appointee by the president, Preckwinkle, it would be helpful, I think, if we knew who she's thinking about appointing. That would make a difference as we think about candidates. So I'm wondering if there could be, I don't know if you can say this we're not in a real meeting, but.
I'm happy to ask her. Yeah.
There's a hand up on the screen. Jenny.
Oh, we have somebody.
Jen.
Hi, it's Jen.
Jennifer Vitus, you have a question?
I just wanted to contribute a little bit to the conversation. I think it's probably not a bad idea for us to begin now to, as others have suggested, to source multiple candidates. And I don't know why we would limit ourselves to one this go around, just so that we can get a little bit ahead of the game. And I'll just note that this is not the first time we've sent candidates over and, had a pretty good pool of folks and had them all be rejected. So building a bigger bench seems like a good strategy for us, and, also getting as much clarity as possible about the profile of candidate that, the president's looking for, would help, ensure that, the work that we're putting into this is being done.
Yeah, that would be helpful too.
Yeah, Jen, I couldn't hear everything that you said, very clearly, but I think what you're asking for is more clarity from the president about what she's looking for. Right? Did I hear that correctly? Yeah, thanks.
Yeah, that's right.
Yeah, because the only, we did get a little bit of information, but not very much from the president, and she mentioned nurses, and I think most of us, we do have 2 nurses on the board right now, and. This time she did not mention nurses. This time she didn't, she mentioned women this time, yes, okay.
But didn't we give her 2 women? I know,
We did.
2 women and one that was head of a hospital, and a second one who had headed up the state
Right.
health and finance system.
And
So I guess that I sort of agree with Jennifer. It would be nice to pick up the phone and ask her, like, what was the problem?
Mm-hmm. Yeah, because what we got was due to potential conflicts and other extenuating circumstances, which doesn't help me a lot to understand what the problem is, and I'm happy to try to reach her by phone. Anyway, I will try that. Anything else?
Could just quickly raise a sort of a procedural question. So, in a world of ambiguity as to what we're actually looking for, the notion of potential conflicts, is there any, and I think Jenny used the term deeper bench, is there any procedural mechanism by having like some other names approved beyond like the 3 that we turn over and just say, okay, this is next up, and if there's a conflict or something like that, immediately swap in, just by expedition, or do we have to go back to the well altogether? And
Do you want to
Also, what we did last time,
yeah,
we were to provide 3 names to the president, and there was some very early glitch right after we gave her the names, and one withdrew. And so rather than send all of them back, she just asked for 1 more, and we did have one candidate that was next in the lineup that it wasn't specifically mentioned during the meeting that they were going to do that, but they were the next natural candidate that would have been sent. Right. So prior to sending that name to the president, Margie sent an email out. I sent an email out based on Margie saying, hey, this is what we'd like to do. They need 1 name. Does anyone have any issues with doing that? Didn't hear anything back, so that's what we did. So it would be nice to have a formalized backup list for cases like this, like you mentioned. Yeah.
okay, thanks.
Right, so hopefully we will get 1 name from most of our organizations, so that should this happen again where we submit 3 and she rejects them, we do have the bench. Yep. Any other questions? I'm hoping this plan works for everybody, but do let Deb know if there's a problem with it. So we're looking at March 29th meeting, March 25th by 3 p.m. Send your recommendation to Deb using the nominating form that we've used before.
And after the meeting, I'll send an email recapping what happened today and mentioning the fact that if anyone has any issues with this plan, let me know and I'll forward that information to you.
And let's give everybody a deadline of, like, close of business tomorrow.
Yeah.
Okay. Thank you.
And I make a motion to adjourn, except we're not in
Okay, go for it and find good candidates, everybody. Thank you. Thank you. Does my parking still get that one? Yeah, really, let's get to the important stuff.
We're here long enough. Do you have a ticket?
I do.
I need to write something on it so it gets copied.
Deb has a secret code she
Secret
uses.
code.
It's very intricate. It's very, you'll never crack it.
Thank you, Deb, for trying so hard. Sorry, this is your first meeting.
No, I was told to expect this, so.
You're-
That's why I was suggesting.